You know that piece of advice people give you when you're just totally overwhelmed? The one that makes you want to immediately scream?
Oh, you mean the classic, just relax?
Yes, just relax. It is arguably the least relaxing phrase in the English language.
It really is. I mean, has telling someone to just relax ever actually worked?
Probably not, no. But today's deep dive actually takes that exact frustration and validates it on a purely biological level.
Which is so incredibly validating to hear.
Right. So, we are looking at a stack of sources today for you. We've got clinical guidelines from the British Menopause Society, we have protocols from the National Institute for Health and Care Excellence, and some really fascinating endocrinology research on the body's stress response system.
Yeah, the Cleveland Clinic data in there is particularly eye-opening.
It really is. And the core mission of this deep dive, what we really want to unpack for you, is the biological link between chronic stress and menopause symptoms. And more importantly, how specific mindfulness techniques can literally rewire your body's response.
Because, menopause is this massive biological transition, and it hits right when life is arguably at its absolute most demanding.
Oh, definitely.
You're looking at peak career responsibilities, maybe teenagers at home, aging parents, financial pressures. It's a lot.
It's a perfect storm. And for a long time, the medical advice was just so dismissive.
Completely. Just chalking up poor sleep or
Yeah.
hot flashes to, midlife stress.
Yeah, or framing it as this sort of emotional inability to cope. But current research shows this is not an emotional failing.
Not at all. It is a fundamental structural shift in your biology.
And the foundation of all this, based on the sources, is the HPA axis.
Right, the hypothalamic pituitary adrenal axis.
Exactly, the HPA axis. We tend to treat the human stress response as this monolith, like it's the same for everyone. But looking at the endocrinology sources, the female HPA axis is actually structurally different from the male HPA axis.
It is, and this is a key insight. Estrogen actually stimulates the HPA axis.
Wait, really? It stimulates it?
Yes. At both the hypothalamic and adrenal levels, it basically amplifies that initial cortisol response.
Wow.
And furthermore, the female system has a longer post-stress cortisol recovery curve, whereas testosterone in men does the exact opposite. It inhibits the HPA axis and dampens the stress response.
Wait, so stress isn't just stress for everyone. A man and a woman could experience the exact same stressful event, but their biological recovery timeline is completely different.
Exactly. The physiological timeline is completely built.
It's like, okay, think of it like a car alarm. In a male body, the alarm gets bumped, it goes off, and then it just resets quickly.
Right.
But in a female body, the alarm goes off and just keeps blaring long after the threat is completely gone.
That is a perfect analogy. And for years, the hormonal buffers of estrogen and, progesterone, they help manage that highly reactive system.
Because progesterone has a calming effect, right?
Yes, it has a very soothing effect on the central nervous system. But during perimenopause, those hormone levels don't just gently drop. They fluctuate wildly.
So you lose the predictable buffer.
Exactly. You lose the progesterone buffer, and the estrogen that was already amplifying your stress response becomes super erratic.
Which means a stressful event you might have just brushed off in your 30s suddenly feels intensely physical in your late 40s.
Because your baseline cortisol stays elevated.
Yeah.
Your body is trying to adapt to a totally new hormonal environment.
Okay, so that elevated cortisol, how does that translate to the actual physical symptoms, like specifically the hot flashes that affect, 80% of women?
Yeah, that's a huge percentage. So the physiological load of carrying that elevated cortisol fundamentally changes how the brain regulates the body.
Okay.
Because the hypothalamus initiates the stress response, right? But it's also the brain's internal thermostat.
Oh, wow. I didn't realize it did both.
It does. And estrogen is what keeps that thermostat stable. So as estrogen drops, the thermoneutral zone...
Meaning the temperature range the brain considers normal?
Exactly. That zone narrows drastically, so a tiny, almost imperceptible increase in your core body temperature suddenly makes the brain think, oh no, we are overheating.
And it triggers an emergency cool down.
Right. Blood vessels dilate to release heat, your heart rate spikes to pump blood to the surface of the skin, and your sweat glands activate.
The classic hot flash.
Exactly.
But if your baseline cortisol is already sitting higher because of that lost progesterone buffer, how does stress factor into that? Does it make it worse?
Oh, it absolutely amplifies it. Stress hormones like cortisol and adrenaline directly amplify the reactivity of that internal thermostat.
So it's a feedback loop.
A vicious one. Let's say you're in a meeting and you feel a hot flash starting. You might naturally feel anxious about people noticing.
Right, you get flushed and panicked.
And that panic dumps adrenaline into your bloodstream. Because the hypothalamus is already hypersensitive, those stress hormones basically throw gasoline on the fire.
Prolonging the hot flash.
Yes. And eventually, just the anticipation or the fear of having a hot flash puts your nervous system on high alert.
Which alone can trigger a hot flash.
Exactly. The fear of the event triggers the actual vasomotor event.
Okay, but if you're in the middle of that, racing heart, sweating, feeling totally overwhelmed, how do you even know if a hot flash is caused by hormones or if it's just pure anxiety?
It's a great question, and they feel very similar. But the sources do point to a diagnostic distinction based on timing and triggers.
Okay, what's the difference?
Well, anxiety-driven hot flashes usually last about 1 to 5 minutes, and they are clearly linked to a specific emotional trigger or a stressful thought.
Got it. And the hormonal ones?
Hormonal hot flashes generally last a bit longer, like 2 to 10 minutes. They're more consistent over time, and they frequently happen at night.
The dreaded night sweats.
Right, causing severe night sweats. But the cruel irony is, both of them destroy your sleep architecture.
And sleep deprivation impairs temperature regulation even more, right?
Yes, it spikes the next day's baseline cortisol. You wake up exhausted, stress hormones are high, making the hypothalamus more reactive.
Which causes more hot flashes. It really is a relentless looping trap.
It is. But breaking that loop is where the clinical interventions come into play. Specifically, interventions focusing on the cognitive load that drives those cortisol spikes.
Which brings us to the CBT part of the sources. And I have to admit, seeing cognitive behavioral therapy, which is a psychological talking therapy,
Right.
seeing that as a frontline recommendation from bodies like NICE for physical symptoms like hot flashes and night sweats, it gave me pause.
I'm sure. It sounds a bit counterintuitive.
It does. Can thinking happy thoughts really stop you from physically sweating through your clothes? When someone is dealing with a severe physiological reaction, telling them to reframe their thoughts feels uncomfortably close to that just relax advice we were just complaining about.
That skepticism is completely valid. It is actually a recognized hurdle in clinical settings when they introduce this.
Because it takes immense mental energy to implement CBT, and that is exactly what a sleep-deprived person going through menopause does not have.
Exactly. But the key distinction the sources make is that CBT is not meant to prevent the physiological drop in estrogen. It doesn't stop the initial narrowing of the thermoneutral zone.
So it doesn't stop the hot flash itself?
No. The goal is to interrupt the secondary stress response.
Okay, walk me through that.
So, when you wake up drenched in sweat at 3 in the morning, the biological event has already happened.
Right.
But your immediate thought is probably something catastrophic, like, my sleep is ruined, I won't be able to function tomorrow.
Which is a very natural thought to have in that moment.
It is. But that thought signals the adrenal glands to release more cortisol, which then keeps you awake for another 2 hours.
Ah. So CBT targets the cognitive appraisal of the event, how you interpret and respond to the physical sensation.
Exactly.
Yeah.
The Menopause studies referenced in the British Menopause Society guidelines are fascinating on this. They show that 2 women can have a hot flash of the exact same physical intensity.
Same temperature, same sweat.
Yep. But their distress levels are completely different based on their cognitive appraisal. The data indicates CBT reduces how bothersome the flashes are by 30 to 40%.
Wow. Even if the raw frequency stays the same.
Yes,
Yeah.
because it stops the brain from dumping stress hormones into an already uncomfortable physical event.
So how do you actually do that? How do you reframe those catastrophic thoughts?
Well, women who experience the highest distress tend to catastrophize. So say you're having a daytime flush. The automatic thought is often, everyone is looking at me and I look terrible.
Right. Total panic.
CBT trains you to systematically challenge that with evidence. So you change it to the reality, which is people are unlikely to notice, and even if they do, they won't judge me. I notice my flushes far more than anyone else does.
That makes sense. Or with the 3 a.m. night sweat panic.
Exactly. Instead of, I can't cope with this, I'll never get back to sleep, you reframe it to, this is uncomfortable, but it will pass in a few minutes. Let's just take it one flush at a time.
And removing that panic lowers the cortisol, which allows the parasympathetic nervous system to kick back in so you can actually return to sleep.
Precisely. It changes the biological cascade.
But sometimes the brain is just too panicked to reason with. I mean, your sympathetic nervous system is so fully engaged, cognitive reframing just isn't possible.
Oh, absolutely. The cognitive reserves are too depleted, and you literally cannot think your way out of the anxiety spike.
So what physical tools do the sources offer to short-circuit that stress response in the moment?
When you need a physical intervention to override the system, the clinical literature points heavily to paced breathing as the most effective immediate tool.
Paced breathing, so slower, diaphragmatic breathing.
Right. Slowing the breath down to about 6 to 8 breaths per minute.
The biological mechanism behind this is wild, because most of us breathe so shallowly into our chests when we're stressed, right?
And we do. We take these quick, shallow chest breaths that just signal more panic.
But when you engage the diaphragm, that dome-shaped muscle at the base of your lungs, it pulls downward, and it draws air deep into the lower lobes of the lungs.
Yes.
And this physical expansion actually stretches the lung tissue, which stimulates stress receptors, and it also changes the pressure in your chest cavity.
Which is the crucial part because that change in pressure stimulates baroreceptors in your blood vessels.
Right, and those receptors send an immediate mechanical signal up the vagus nerve to the brainstem,
Exactly. The brainstem responds to that signal by releasing acetylcholine.
which is a neurotransmitter.
Yes, and acetylcholine physically slows down the pacemaker cells in your heart. You are literally sending a biological signal to the brain that says, we are safe.
Bypassing the panicked cognitive brain entirely. It really is like a manual override switch for your nervous system.
Yeah.
You physically force the body out of a panic state.
It is a manual override. And the sources detail specific methods to maximize this, to really trigger that vagal tone response right when a hot flush starts.
Box breathing is a big one mentioned.
Yeah, box breathing is great. You inhale for 4 counts, hold for 4, exhale for 4, and hold for 4.
And then there's the 4-7-8 technique.
Also highly recommended. You inhale through the nose for 4 seconds, hold for 7, and exhale completely through the mouth for 8 seconds.
It's the sort of whoosh sound, right?
Yes, that long, extended exhale is what really activates the parasympathetic response, the rest and digest mode.
It's amazing that we have that built-in hardware.
It is. And the research emphasizes that this isn't just about surviving a single hot flash.
It changes things long-term.
Yes. Regular mindfulness and paced breathing practices over time actually change the physical structure of your brain.
Right, really. It changes the structure.
Yes. It reduces the volume of the amygdala, which is the brain's fear and reactivity center, and it increases the volume of the hippocampus, which handles emotional regulation.
So you shrink the alarm bell and strengthen the regulator.
Exactly. Which permanently lowers your baseline cortisol levels.
That is incredible. Now, beyond the breathing and the CBT, the sources also delve into nutritional scaffolding for the HPA axis.
Ah, yes. The adaptogens.
Right, specifically adaptogens like ashwagandha. And I feel like the term adaptogen gets thrown around a lot in wellness spaces, usually without much scientific context.
Very true. It's become a bit of a buzzword.
But the biological mechanism outlined in the research is actually quite specific.
It is. Because adaptogens don't work like pharmaceutical sedatives or stimulants. Those force the body in one specific direction, regardless of what state it's currently in.
Right, they just brute force it.
Exactly. But the research highlights ashwagandha because of its active compounds, which are called withanolides.
With phenolate.
Yes, they are steroidal lactones, and they are structurally very similar to our own endogenous stress hormones.
Okay, so because of that structural similarity, they can interact with our cells in a unique way.
Yes, the withanolides can act as competitive antagonists at the receptor sites.
Meaning they compete with cortisol to get into the cell.
Exactly. If you're in the middle of a high-stress period and your adrenal glands are flooding your system with cortisol, the withanolides bind to those cortisol receptors first.
Because they look so similar.
Right. They occupy the space, essentially blocking the actual cortisol from overstimulating the cells. They blunt the physiological impact of that stress spike.
That makes so much sense.
But conversely, if you are experiencing that profound exhaustion that often follows chronic stress, where the HPA axis is so fatigued that your natural cortisol curve is just flattened out.
Which happens a lot during menopause.
It does. In that state, those same withanolides can exert a mild supportive effect on the empty receptors. They help restore a functional rhythm.
So in the context of menopause, as the supportive scaffolding of estrogen and progesterone is removed, adaptogens provide a temporary alternative scaffolding for the HPA axis.
Exactly. Preventing it from getting stuck in that hyperreactive, blaring car alarm position.
So we're really hitting the problem from 3 different biological angles here.
We are.
You have the adaptogens supporting at the hormonal and receptor level. You have paced breathing, directly stimulating the vagus nerve to halt a hot flash in its tracks. And you have CBT rewiring your cognitive appraisal to prevent the stress loop from starting in the first place.
Exactly. The clinical guidelines aren't just telling women to manage their stress as some sort of empty platitude.
No, not at all.
They are offering targeted, evidence-based mechanisms to regain control over an incredibly turbulent biological transition.
So, to summarize the core message of this deep dive for you listening, your menopause symptoms are not just in your head. They are deeply rooted in a shifting biological landscape and a highly sensitive female HPA axis.
But your head is a powerful tool to manage them.
Exactly. You can't control the dropping estrogen that narrows your internal thermostat, but by understanding your unique stress response and using tools like CBT and paced breathing, you can control the anxiety that amplifies the discomfort.
You are not at the mercy of your symptoms.
Right. Now, as we wrap up, there's a really interesting final thought to mull over.
Yeah, I love this part.
We've just spent this deep dive exploring how deeply our cognitive appraisal, the stories we tell ourselves in a moment of panic, can physically alter the intensity of a menopausal hot flash.
It really begs an important question.
It does. What other physical discomforts, aches, pains, or moments of sheer exhaustion in our daily lives are being secretly amplified by the quiet, catastrophic monologues running in the background of our minds?
It's a profound thing to think about. How much of our physical pain is amplified by our thoughts about the pain?
Exactly. So the next time you feel that panic rising, take a slow, deep, paced breath. Remember that you have the manual override switch and go tackle your day.